The Government Nursing Officers Association and the Public Service United Nurses Union say that the strike action they initiated several days ago was abandoned this morning. However, yesterday the All Ceylon Nurses Union noted that they would continue with their strike action. Meanwhile, the Joint Council of Professions Supplementary to Medicine launched a strike in 3 provinces today, citing several demands. Our reporters say that this strike too affected several hospitals.
The Joint Council of Professions Supplementary to Medicine launched a strike action from 8 o'clock this morning at hospitals in the North Central and Eastern provinces. The General Secretary of the Joint Council, Samanja Sekro, says that 1,100 officials representing 5 professions are participating in the strike. The strike was launched citing demands including the granting of promotions to first and special grades which have not been granted over the past 8 years, establishing a quality private healthcare service, the implementation of proposals submitted to the Ministry of Health, and the reversal of cutbacks to university healthcare degrees. Laboratory services, pharmaceutical services, x-rays and scans, physiotherapy and chiropractic treatments have been affected by the strike action. This footage was captured from the Anuradhapura Teaching Hospital this morning.
ඊයේ තෙද නිලධාරීන් ස්ට්‍රයික් අද මේ බේත් දෙන තැන්වල මේ කවුන්ටර් වල කිසිම කෙනෙක් නැහැ ඒගොල්ලොත් ස්ට්‍රයික් අපි දුප්පත් මිනිස්සු
වර්ජනයක් කියනවා මොනවද කියලා දන්නේ නැහැ අපිට තේරෙන්නේ නැහැ ඉතින් මොනවා වුණත් කරන්නේ රෝගීන්ට ලොකු අසාධාරණයක් කවුරු කරත්.
Services at the Polonnaruwa General Hospital were also dysfunctional as a result of the strike.
අහුතාට එහෙම වෙහෙත් නැහැ මානසික සායයෙන් මේ කකුල් අමාරුව වෙහෙත් ගන්නවා අපි දන්නේ නැහැ මොකද කරන්නේ තුණ්ඩුවක් කියලා දුන්නා මේ පාමසෙන් ඔසුහලෙන් ගන්න කියලා අපි දන්නේ නැහැ මොනවද මේ කරන්න කියලා.
හැමදාම මේක කරන්න බෑ දෙයියනේ මේ කාට හරි මේ විසඳුමක් කරලා මේක ඉවරයක් කරලා දාන්න නැත්තම් මේ දුප්පත් මිනිස්සු මැරලා යයි.
The strike was also in effect at the Trincomalee General Hospital. A similar situation was witnessed at the Jaffna Teaching Hospital. It is disappointing that the authorities have not initiated a proper program. Thereby, we have informed the Health Ministry that if these issues are not resolved during the course of the day, we have 1,400 officials stationed at all hospitals in the northwestern, Sabaragamu and Uva provinces who will also join the strike action. Meanwhile, 2 nurses' unions agreed to abandon the nurses' strike that has been continuing over the past several days this morning. However, the All Ceylon Nurses Union noted that they will continue with the strike until their demands are fulfilled.
ඔවුන් කිසිදු ඉල්ලීමක් දිනා ගන්න නැතුව කිසිදු එකඟතාවයක් නැතුව අමාත්‍යාංශයෙන්
They have abandoned their strike action without winning any of their demands, without reaching an agreement and without obtaining any written promise from the Ministry of Health. They have betrayed the nurses' struggle. Thereby, we have decided to continue with this strike action.
සම්පූර්ණයෙන් පාවලා දුන්නා. ඒ අනුව අපි තීරණය කරා මේ වැඩවර්ජන ක්‍රියාමාර්ගය තවදුරටත් ඉදිරියට ගෙනියන්න.
Meanwhile, tensions flared at the Kurunagala Teaching Hospital when the president of the Government Nursing Officers Association, Saman Ratnapriya, arrived there to meet members of the union. Although the nurses' strike has been abandoned by 2 of the main unions, the nurses of the Kurunagala Teaching Hospital did not report to work today either. Services at the hospital were carried out by doctors and minor staff today as well.
The strike has been continuing for more than a week now in the Kurunagala Teaching Hospital. Even now, several days have passed with no emergency services. However, the doctors, specialists and all other staff at the hospital are executing these duties. At present, about 800 to 900 patients are receiving in-house treatment. The president of the Government Nursing Officers Association, Saman Ratnapriya, says that the strike is continuing at the Kurunagala Teaching Hospital owing to administrative problems. It was the nursing administration that administered and managed the family health service. Following a verbal order by the Director of Health Services, the Director of the hospital has taken a different decision. We cannot acquiesce to this decision. Thereby, although we halted the strike action yesterday in the people's best interest, we have decided to continue the strike at the Kurunagala Teaching Hospital.
මෙතෙන්ද කිසිම අවස්ථාවක කිසිම වෛද්‍යවරයෙක් කියලා නැහැ හෙදියන්ට මේ සූතිකා පුහුණුව ලබා දෙන්නේ නැහැ කියලා.
No doctor has said at any instance that labour room training will not be provided to nurses. They are not asking that this training be provided for nurses. They are asking that it be provided to students.
These students have not even had their results released as yet. We still do not know how many of them have passed and how many have failed the examination. The unions are asking that these people be given labour room training. As a competent institution, we say do not do this. This will be a major injustice to pregnant mothers in Sri Lanka.
මේ ලංකාවින මාතෘ බබාලා හම්බෙන්න අම්මලාට විශාල අවතක් කරන්නේ